السلام عليكم، ازيكم يا شباب؟ ان شاء الله محاضرة النهاردة من الانفكشن كنترول بعنوان community acquired infection under supervision بروفيسور دكتور أماني شبل assist بروفيسور دكتور كريمة الشامي prepared by رنا صبري. عندنا اول حاجة الاوتلاين بتاعتنا، هنقول introduction to community acquired infection, definition of community acquired infections, symptoms of community acquired infections, types of community acquired infections, causes of community acquired infections, prevention of infection in the community. وهنتكلم عن two common diseases هما النيمونيا والإنفلونزا. أول حاجة الانترودكشن، بنقول infections have a multifactorial etiology and are related to intrinsic and extrinsic factors that involve human endogeneity and environmental conditions respectively. Thus, social and environmental determinants such as educational level, poverty, lack of information, poor housing, and inadequate sanitation are linked to the development of infection, especially in the home environment. معناه ايه الكلام ده يا شباب؟ معناه بنقول ان الانفكشن لها اكتر من سبب وبتكون related لاسباب داخلية واسباب خارجية include الhuman endogeneity والenvironmental condition respectively، زي السوشيال والenvironmental determinants زي عندنا زي educational level، poverty، lack of information، poor housing، inadequate sanitation. بنقول ان دولت بيقولوا linked to development of infection وخاصة في الهوم environment. Since 1970, infections have been categorized as either community acquired or hospital acquired, and infections acquired in the community, in contrast to nosocomial or hospital acquired infection. Community acquired infections are infections that are contracted outside of a healthcare setting. Patient can expose other patients to community acquired infections upon admission. Unless the chain of infection is broken, a healthcare facility can be put at risk of an infection outbreak. يعني معناه ان ال community acquired infection دي هي الانفكشنز اللي بتحصل outside ال healthcare facility او ال healthcare setting. البيشنت بيدخل الهوسبيتال وهو already عنده الانفكشن، وده ممكن يكون ان هو يسبب ان هو expose ال other patient للانفكشن دي، الا لو حصل break لل chain of الانفكشن، والا ممكن في المحتمل ان يحصل عندنا ان ال healthcare facility تتعرض للانفكشن. definition of community acquired infection بتقول ان community acquired infection او community associated infections defined as infections manifesting and diagnosed within 48 hours of admission in patient without any previous encounter with the home in a community environment outside of the hospital, even if patients are admitted to the hospital during the course of illness. برضو معناها ايه؟ معناها ان هي حصلت outside of the health care facility، وان بيتم اكتشافها في خلال 48 ساعة from الادميشن، وحتى لو البيشنت admitted خلال during the course of illness. acquired infection has its own set of symptoms. General symptoms can that apply to the number of infections include muscle aches, fever, fatigue, diarrhea, and coughing. The most common types of community acquired infection بنقول one of the most common community acquired and morbidity worldwide. Other types of community acquired infections include influenza, hepatitis C virus, human immunodeficiency virus, acinetobacter, norovirus infections, botulism, asymptomatic bacteria, antimicrobial resistant infection, tick-borne illness. The causes of community acquired infections can be caused by a variety of pathogens زي الفيروس، البكتيريا، البارازيتس والفنجاي. while some infection can spread from person to person, others are transmitted through bites of animals or insects, others can be caused to harmful environment or organisms. طب ازاي نعمل prevention of infection؟ بنقول ان ال prevention of infection in the community can be done by 5 things. اول حاجة عندنا هي ال hand washing، ان عن طريق ان احنا بنعمل perform ال hand hygiene using ال alcohol based hand rubs or soap and water as described in routine practices. ال health care provider must follow aseptic technique, they must clean their hands or wear gloves. من الخطوات المهمة برضو علشان نعمل prevention of infection ان احنا نعمل cover your mouth and nose when coughing or sneezing to prevent the infection transmission. If any person is sick, he must get shots to avoid disease and fight the spread of the infection. Pneumonia is an infection in one or both lungs caused by bacteria, virus, and fungi. The infection in lungs, which are called alveoli. The alveoli fill with fluids or pus, making it difficult to breathe. The symptoms of pneumonia. Pneumonia symptoms can be mild to life-threatening. They can include coughing that may produce mucus, fever, sweating or chills, shortness of breath that happens while doing normal activities or even while resting, chest pain that's worse when you breathe or cough, feeling of tiredness or fatigue, loss of appetite, nausea or vomiting, headaches. Other symptoms can vary according to your age and the general health. The children under 5 years old may have fast breathing or wheezing. The infant may appear to have no symptoms, but sometimes they may vomit, lack energy, or have trouble drinking or eating. Older people may have mild symptoms. They can also exhibit confusion. Types of pneumonia. Pneumonia can also be classified. Community acquired pneumonia refers to pneumonia that is acquired outside of a medical or institutional setting. Hospital acquired pneumonia is acquired during the hospital stay. It can be more serious than other types as the bacteria involved may be more resistant to antibiotics. بعد كده في عندنا ventilator associated pneumonia. When people who are using a ventilator get pneumonia, it is called aspiration pneumonia. Aspiration pneumonia happens when you inhale bacteria into your lungs from food, drink, or saliva. This type is more likely to occur if you have a swallowing problem or if you are too sedated from the use of medications, alcohol, or other drugs. Pneumonia treatment. Your type of pneumonia you have, how severe it is, and your general health. First, prescription medication. Your doctor may prescribe a medication to help you treat your pneumonia. What you are prescribed will depend on the specific cause of pneumonia. Oral antibiotics can treat most cases of bacterial pneumonia. Antibiotic medications don't work on the viruses. In some cases your doctor may prescribe an antiviral. يعني في الفيرست احنا بنعمل prescription للميديكيشن. الدكتور may prescribe الميديكيشن. نوع الميديكيشن prescribed هيبقى dependent on the specific cause of pneumonia. البكتيريا النمونيا ممكن الدكتور يوصف لها الاورال انتيبيوتكس، بس الانتيبيوتيك ده هيبقى don't work on الفيروس. الحالة دي الدكتور ممكن يعمل prescribe للانتي فيروس. Doctor may also recommend over-the-counter medication to relieve your pain and the fever as needed. They may include aspirin. Your doctor may also recommend cough medicines to calm your cough so you can rest. You can help your recovery and prevent a recurrence by getting a lot of rest and drinking plenty of fluids. Hospitalization. If your symptoms are very severe or you have other health problems, you may need to be hospitalized at the hospital. At the hospital, doctors can keep track of your heart rate, temperature, and breathing. Hospital treatment may include intravenous antibiotics injected into a vein, respiratory therapy, which involves delivering specific medication directly into the lungs or teaching you to perform breathing exercises to maximize your oxygenation, oxygen therapy to maintain an oxygen level in your bloodstream received through a nasal tube, face mask, or ventilator depending on severity. تاني disease هنتكلم عنه النهاردة هو الانفلونزا. الانفلونزا بنقول الانفلونزا commonly known as the flu is an infectious disease caused by an influenza virus. Signs and symptoms. Symptoms can be mild to severe. Symptoms of influenza can start quite suddenly 1 to 2 days after an infection. هيبقى عندنا في fever and chills, cough, nasal congestion, runny nose and sore throat. في هنا عندنا hoarseness, earache, muscle pain, fatigue, watering eyes, reddened eyes, skin, especially the face, the mouth, the throat and the nose, petechial rash. emergency warning signs هيكون عندنا في البيشنت عنده shortness of breath, في عنده short pain, في عنده dizziness, confusion, في extreme vomiting, flu symptoms that improve but then relapse with a high fever and severe cough, can be bacterial pneumonia, في cyanosis, patient عنده high fever and a rash, inability to drink fluid. The types of the virus. نقول 3 of the 4 types of influenza viruses affect the human وهما الانفلونزا فيروس A, influenza virus B, influenza virus C. الانفلونزا virus D may be or may not affect the human. Transmission. بنقول usually the virus is separated through the air from the coughs or the sneeze. This is believed to occur mostly over a relatively short distance. It can also be separated by touching surfaces contaminated by the virus, and then a person may be infectious to others both before and during the time they are showing symptoms. The infections may be confirmed by testing the throat, sputum or nose. A number of rapid tests are available, however, people may are negative. Correct. By direct transmission, when an infected person sneezes mucus directly into the eyes, nose or mouth of another person, the airborne route. When someone inhales the aerosols produced by an infected person, coughing, sneezing or spitting, through hand to eye, hand to nose or hand to mouth transmission, either from contaminated surfaces or from direct personal contact such as the handshake. Reasonably effective ways to reduce the transmission of influenza include good personal health and hygiene habits such as not touching eyes, nose or mouth, frequent hand washing with soap and water or with alcohol based hand rubs, covering coughs and sneezes, avoiding close contact with sick people and staying home when sick, avoiding spitting is also recommended. وهنكمل بعد كده باقي اللي هو الموست common diseases في الأجزاء التانية إن شاء الله.